This is the Medicare fork in the road right here. You're going to go one way or you're going to go the other way. And I'm not going to need to tell you which way that you're going to go. You're going to figure this out on your own. Everybody here is old enough to remember the old commercials with Microsoft and Apple. I'm a Mac, I'm a PC. You remember those? Yeah. You're going to be an Advantage person or you're going to be a Medigap person, and you'll figure that out on your own. So I will tell you up front that I favor Medigap plans. And it's not because Medigap plans have premiums. It's because I think there's some wisdom to that. I'm going to explain the wisdom behind that. Most people, when they come to these classes, they've never even heard of that. All they've ever heard of is the Advantage plans. Like, all my friends have Advantage plans. Those are the ones that they see on the commercials. Whenever you see Joe Namath and J.J. Walker and those commercials that come on, that's what they're talking about, is Advantage plans. And so that's the one that most people are acquainted with. Usually about 20 minutes into this conversation, we start talking about Medigap plans and the lights come on. Now, the Advantage plans, just so you know, in full disclosure, I get paid by insurance companies whenever I enroll people in Medicare plans. And so it never costs people anything for me to help them with this stuff, but the insurance companies pay about 2 or 3 times as much over a person's lifetime for an Advantage plan. Therefore, these get pushed very heavily. Now, they're an easy sell because these have 0 premium. You tell people it's not going to cost you anything. Somebody is back here saying, well, wait a minute. Free insurance? What's the catch? Well, if you enroll in their, it's not free. We're not supposed to call it free. 0 premium coverage. You've got to play by their rules. And there's lots of rules that go with that. And we're going to talk about those. So these are 0 premium. They're guaranteed issue, which means it doesn't matter what your health condition is, you can enroll in one of these plans. You could have cancer, you can have diabetes, you could have chronic heart disease, you could have kidney failure, you can enroll in an Advantage plan. Now, these are often called by your providers. A provider is a fancy word for doctors and hospitals and those that help you with health care. These are often referred to as replacement plans. They seldom call them Advantage plans. If you're talking to your doctor's office, they're going to call these replacement plans. The reason that they're called replacement plans is because they're not actually, even though this is Medicare Part C, they're not actually provided by Medicare. They're provided by private insurance companies. And the private insurance companies take over what the government would be providing here with Part A and Part B. And the deal is that the government tells the insurance company, we will pay you some amount of money, X number of dollars per capita for each person that you enroll in your plan, but you have to provide them with coverage that is equal to or better than what we would provide them. And the insurance companies say, hey, we will take you up on that. And then they start adding things on to make their plan more attractive than the other guy's plans. And so therefore you see these Advantage plans typically with Part D, prescription drug coverage, bundled in. You see them with dental, vision, and hearing included. It may not be the greatest dental, vision, and hearing coverage, but they'll usually have them on there. They might have fitness memberships. They might have all kinds of things. Like I said, if you've ever seen the J.J. Walker commercials or the Joe Namath commercials, you've heard about all of the supplemental benefits that you can get at no additional cost to you. Not going to cost you an additional dime to be on their plan, to enroll in their plan. And therefore, those are very attractive to people. I like all those supplemental benefits.